Morning, everyone. My name is Rod Liu, and I'm the Executive Director of APPEAL, Asian Pacific Partners for Empowerment, Advocacy, and Leadership. On behalf of APPEAL, I want to thank you for joining us for our second annual Breathe Free Day. APPEAL is a national health justice organization committed to eliminating health disparities in the Asian American, Native Hawaiian, and Pacific Islander communities. For over 30 years, we've led the fight for tobacco control in these communities. And last year, we launched Breathe Free Day to honor the struggles and victories of our communities in that fight. This year, our message is even more urgent. The recent decision by the current administration to eliminate the entire tobacco control program at the Centers for Disease Control and the Food and Drug Administration is unacceptable. This move will disproportionately harm communities that are already underserved, especially Native Hawaiians, Pacific Islanders, and Asian Americans. We know the data. When the data is disaggregated, it clearly shows that several Native Hawaiian, Pacific Islander, and Asian American subgroups have higher rates of tobacco use than the general population. We know nearly 500,000 lives are lost each year in the United States due to commercial tobacco-related diseases. And we know that tobacco control works. It's one of the greatest public health achievements of the last 50 years. Tobacco control policies have protected vulnerable communities from secondhand smoke, prevented youth access to this addictive substance, and have saved lives. But beyond the human cost, there's also a real economic cost. During this time of economic uncertainty, it's important to remember that tobacco control programs have actually saved our country money, reducing an estimated $225 billion in medical costs and another $150 billion in lost productivity due to tobacco-related diseases every year. Despite that, we're now seeing critical programs like the Asian Smokers Quit Line, serving Cantonese, Mandarin, Korean, and Vietnamese speakers, nationwide, losing federal funding outside of California. We are moving backward at a time when we should be moving forward. Breathe Free Day is about more than just being smoke-free. It's about justice. It's about equity. It's about freedom. Breathe Free means freedom from the tobacco industry's predatory marketing. Breathe Free means having the right to health care, including culturally and linguistically tailored tobacco control programs. Breathe Free means access, language access, program access, healthcare access. Breathe Free means living free from the stress and harm caused by anti-immigrant policies. Breathe Free means supporting, not targeting our communities. And Breathe Free means the freedom to live healthy, empowered lives. Today, we honor the loved ones we've lost to tobacco-related diseases. For me, it was my Aunt May many years ago. And we lift up the caregivers, health workers, and advocates who stand with our communities every day in this fight. As we mark the first day of Asian American, Native Hawaiian, and Pacific Islander Heritage Month, let us remember not only our family and community members who have died from tobacco-related diseases, but also our strength, our resilience, our perseverance, our many victories against the tobacco industry. We are here because of decades of grassroots advocacy, of speaking truth to power, and of standing together. We have many powerful stories to share today, and with that, I'm honored to introduce our distinguished panel to you. First up, we have Veasna Mai. Veasna is a 1.5 generation Cambodian American living in Long Beach, California. As a refugee who escaped the Cambodian Genocide, he will share his personal story about tobacco companies' impact on his life and health. As a former smoker and a longtime community health advocate, Veasna has dedicated over 10 years to preventing tobacco use and preventing families from the dangers of secondhand smoke. Next would be Taunuu Ve'e. Tau is the executive director and co-founder of the Regional Pacific Island Taskforce. Tao brings over 30 years as a national advisor to leaders on Pacific Islanders, both in the continental U.S. and the U.S. affiliated Pacific Island jurisdictions, on improving health justice across policy outcomes. Today, she continues to use her voice as a California Commissioner for Asian and Pacific Islander American Affairs, the advisory board member for community engagement at UC San Francisco's Helen Diller Cancer Center, and a board member for the California Pan-Ethnic Health Network, or CPEN, for all communities in California. And then finally on our panel is Luci Latu, is a daughter, sister, auntie, partner, friend, colleague, ally, survivor, community member, community health advocate, facilitator, equity champion, and lifelong learner. Luci is the Assistant Director of Taulama for Tongans, a community-based nonprofit organization dedicated to improving the health and well-being of the Pacific Islander community in the greater San Francisco Bay Area through its advocacy for culturally specific and linguistically appropriate health resources and services. Also, partnerships for the empowerment of the Pacific Islander community, and providing outreach, training, and education to increase engagement with social and health services. I'd like to now turn it over to Veasna.
Hi, my name is Veasna Mai. I'm a Cambodian American community member from Long Beach, California, and I want to share my personal story about smoking cigarettes, how it started, what it meant to me, and how it tied to larger issues within my community. I began smoking as a teenager in high school, influenced by peer pressure, social stress, and the environment I was part of, such as working and everybody else smoking around me. So I just tried it and so back then smoking was allowed in many public places such as malls, and it felt like a normal activity, especially surrounded by friends. For me, smoking became coping tool to deal with stress and a way to fit in. It was part of my identity. And within the Cambodian community, it was normalized. Many adults smoked around me, my father, my grandfather, even in the house. And especially those still dealing with trauma from the genocide during the Khmer Rouge regime. So smoking became a way of self-soothe to manage pain that was often left unspoken. So access to cigarettes was also incredibly easy back then. You could buy singles almost anywhere, like at the liquor stores, even donut shops, which made it affordable and tempting. I started off with actually menthol cigarettes too. And on top of that, I grew up during a time where commercial tobacco industry was aggressively targeting young people and communities of color. Billboards were advertised everywhere I went and everywhere in the neighborhoods like mine. There were glossy ads filled with pages of magazines. And when you went to the clubs or the bars, you can get free promotional cigarette packs or coupons. And I even remember collecting cigarette UPC codes and exchanging them for branded merchandise like hats and lighters and camping gear. So it felt like a reward system. The more you smoke, the more rewards you would get. So looking back at it, it's clear how much the industry played a role in shaping our environment and behavior. So my story is not just personal, it reflects a broader social, cultural, and systematic issues. And understanding these connections is important if we want to support healthier communities and break these cycles. And so thank you for giving me the space to share.
My name is Taunuu, and I was asked to use my California Commissioner role to really talk about uh, the importance of hearing the community's voice. And this was an intentionality with another colleague, Commissioner Lance Toma, that, the API usually becomes problematic when we're dealing with our own communities. And listening sessions, we thought it was very important for us to be intentional on hearing the Pacific Islander voice across Northern California, well, all of California. So that intentionality was doing listening session. And, we thank the commissioner for allowing us to do this. We started in San Diego, also we recently completed the Long Beach listening session. and the upcoming one is up here in the Bay Area. And the listening session is very important. We just listen as commissioners. And so for the commissioners, we represent our community and the Asian American and Pacific Islander across all of California. And so for small population like the Pacific Islanders, that invisibility is non-existent when we are still lumping the combining the Asian and Pacific Islander over, umbrella, because we haven't made any progress in separating, except within California. A lot of progress has been made in there, and a lot of it comes from a lot of our local community grassroots, like all of you here today. Lucy, thank you so much always for your voice within the Department of Public Health. And so I'm here to really underscore the importance of when you're invisible, you're underserved and unserved across all of the Bay Area. I've seen it over and over again. And so hopefully my voice will carry through not only in the as a commissioner, because a lot of what we're doing now is educating who are Pacific Islanders within the API, umbrella. But by doing the listening session, we're able to bring our commissioners to actually hear from the community themselves. And so far in San Diego is a full house. There were people that were standing. Also in after San Diego, we were in Long Beach. Thank you, Long Beach. Just the intentionality that we also did was, invite two organizations that have been around for a long time and has a large reach of different coalition of Pacific Islander organization that allows us to open their doors and also promote the listening session that we had as a commissioner. And not only that, my voice through the California, pan-ethnic, that's all people of color. So our policies has to align across all of these platforms. And most importantly, at UCSF, as an advisory board, when we're talking about cancer and different stages of cancer and what happens before you get to stage one, what are some of the preventative and intervention that we can provide culturally, linguistically, and appropriately for all of our community, not just the Pacific Islander, all of the communities across California. And so the space that we take on is very important for some of us that sit on these and on the board and the advisory board, and just a voice, and as a commissioner, I take my job very, very seriously. And hopefully that I can also mentor another person. I don't want to be in this position forever. I want to pass it down to our younger generation, like Lucy and like others, that they can make a big difference in bringing fresh starts and just a breath of fresh air for a lot of our young people. I've seen them in Sacramento 2 days ago. Advocacy Day, our young people are hungry, they are so articulate, and they've got that fighting spirit, for the rights of our community of colors all across the nation, and especially California, where there's such a diverse group of people. So with that, I humbly say thank you so much to Appeal, Rod, for leading this conversation here. And I was so honored to be asked to be one of the panelists. So I hope I provided and I met the requirement, Rod. So for me, Faftay Lava. Thank you.
Malolele, warm greetings to everyone here today. As Rod had originally introduced me, my name is Luci Latu, and I come before you as what was shared, and as a first-generation Tongan American woman whose journey has been shaped by the resilience of our Pacific Islander communities here in the United States. Breathe Free Day is a national day of advocacy and awareness on commercial tobacco, particularly in our Native Hawaiian Pacific Islander and Asian American communities, acknowledging the disproportionate impact of tobacco use on these groups. It's a day dedicated to raising awareness about the negative health impacts of tobacco use and to promote cessation efforts to improve health equity, meaning ensuring everyone has access to the resources and opportunities they need to achieve their best health in our NHPI and Asian American communities. Breathe freely, according to Webster's dictionary, can be understood in two main ways. Physically, meaning to breathe easily and without difficulty, or figuratively, meaning to have relief from anxiety, tension, or pressure. My parents came from Tonga to the United States in the hopes of achieving the American dream. And that has come to mean many different things for many different people. But to my parents and people like them, um, and families like ours, that American dream started with the chance or the opportunity to be and to do anything that they wanted or dreamt of. Possibilities would be endless, which would be beyond what we would be able to do in the islands. And to afford their children and families the same chance, yet the chance and opportunity to be more, do more than what would have been allowed back in the islands. In essence, we dreamt and hoped that coming to America would afford us the chance and opportunity to breathe freely, to breathe without restriction, without anxiety, without tension, and without pressure. However, as Rod stated, the program cuts, for instance, that are conducted from the federal government and the current administration is heating us from breathing freely. They are, in fact, suffocating. Um, One thing that Rod brought up when we were prepping for this webinar was how breathing free meant also being able to access healthcare services, things that needed that we as community members, as just members of the public needed in order to just function, to live. And it touched my heart when he started saying, talking about breathing free, as in the sense of access, having access to healthcare and knowing what my parents came here for. I could never ever fully understand or fathom what it meant like or what it was like to come to a brand new country by themselves and then make their way through it and then to find each other and then build a family from that. They're mavericks of their own in their own right. And I am forever grateful that they were bold enough and strong enough and resilient enough to come to this country. It has afforded us chances. It's afforded us just the ability to dream big for whatever we want. But breathing free means keeping these programs and ensuring that the next generation and the next wave of immigrants that come to this country searching for that American dream, to achieving that American dream, have that opportunity. The current administration is limiting those opportunities. Language access it should be a right, not like not an exception or an option. People not understanding what they're being offered or what is available to them it's not okay anymore. English is not the only language. It's one of many languages. Um, and having access to care should be a right. It's not just, for those that can afford it or for those that are privileged. We all deserve to have the opportunity to live life, and a government or just the entities around us should help us with that, not restrict us from that. My family came here in the hopes of achieving an American dream. I still believe it. The American dream seems forever evasive, but the work that I continue to do with Taulama for Tongans and amongst Appeal, Spark, with the Regional Pacific Islander Taskforce, we're trying to ensure that those things continue to happen, that we are able to live. And the fact that we're struggling for these foundational needs, I know the fight will go on. I know we'll still do what we need to do, but we deserve the opportunity, just the chance. And if those things are not afforded to us, we need to fight for it. I want to thank Appeal and Spark and um, everybody that's on this or who's checking out this webinar for being a part of today, for hearing our message. Many of us came here just for the opportunity, the chance. And I hope that we will continue to fight together and journey together to achieve that chance and that opportunity. Thank you.
Thank you, Lucy. Very, very powerful. Really appreciate everybody's comments. I think you could tell from Veasna, Tao, and Lucy such powerful personal stories that are out there. Thank you so much for sharing that with us. In closing, I'd like to just say for our policymakers, we urge you to protect tobacco control funding. And similar to what Lucy said about freeing us from the suffocation of not having these resources, we'd like you to also uphold our freedom to live tobacco-free. To our community members, we ask you to continue sharing your stories. There are many out there. Your experiences with commercial tobacco-related illnesses and your successes in quitting or helping others quit or create programs that help our communities is vital for everyone to hear. Because to breathe free is to live free. Together, we celebrate Breathe Free Day 2025. Thank you very much for being a part of this.